Right now, would you go to a restaurant?
No, a restaurant to me is too high of a risk because it's an indoor environment.
I'm high risk. I'm high risk for at least three reasons. I've had a stroke in the last 8 years. I have a proclivity toward respiratory illnesses, and I'm over 60. So all three of those things place me at a generally higher risk. And what I know about myself and the disease, I am not going to place myself inside of a restaurant right now.
For the moment, I avoid restaurants unless I could sit outdoors at a corner near a breeze.
I've actually gone out once, other than takeout, and I did my homework. I found out what they've put into place.
I probably would, and I actually went for the first time with my family this past weekend, for the first time since beginning of March.
Would you get on an airplane?
There's even studies that have shown one individual that was infected people many, many rows away. So I think I would pass on the airplane and go ahead and stick with travel on the ground.
No.
I would find that hard to justify.
I have not traveled by air. I've heard conflicting reports from different air carriers in terms of what they're expecting of their passengers and their staff.
I think if I had to travel, I would. I don't know that I would go out of my way to travel at this point via airplane.
And what about ordering takeout, bringing the food back to the house?
Absolutely. There has never been a single case that has been linked to getting takeout food, even having food delivered to your house from the grocery store and places like that. It's such a low risk. I wouldn't worry about that at all.
We have with restaurants that we know.
Great idea. I can attest to the idea that I do that every night.
I don't have a problem with that per se. Again, I would do my homework and find out what precautions the staff are using. I'm not as concerned about surfaces. That's a secondary form of transmission.
I don't see any problem with that at all.
Would you right now send your kids or grandkids to a summer camp?
No. So if I was going to do a summer camp, I would think very seriously about how they're being held. So something that's in an indoor environment is going to be a high risk.
No.
That's a difficult question. I don't think I would do it right now.
It's a tough time for parents because you're balancing a lot of things, but generally having those social activities outdoors for children is really good for their physical and emotional health too.
I think I am okay with that. I think I think the children need that at this point. The parents probably need it also. But that interaction for the child, I think, would be really good for them. I think a lot of the activities tend to be outside, so that's good.
Would you or have you been spending time with relatives and friends that are over the age of 60?
No, not at all. So I don't want to put those people at risk.
I am not spending time with my sons. I have three sons under 40.
Because I'm tested weekly for COVID, yes, I would. If people are following social distancing and wearing a mask, not only outside all the time, which everyone should do, outside and inside all the time, okay? If you wear a mask with these at-risk people, you protect them.
No, I've not. My mother and I have maintained our distance.
So I'm low risk. So if I'm going to spend time with them, it's going to be on their comfort level, not mine, because they're the person at risk. And then I would honestly try to find ways to spend time together in a more safe environment.